October is a month where we shine a light on many health-related issues, and today we're focusing on thrombosis. Thrombosis, or blood clots, is a condition that can lead to severe complications if not addressed. To help us understand more about thrombosis, its risks, and the importance of blood thinners in its management, I'm joined by Dr. Deborah Siegal. Dr. Siegal is an associate professor in the Department of Medicine at the University of Ottawa and a scientist in the clinical epidemiology program at the Ottawa Hospital Research Institute. With over 25 years in the field, she's a leading expert on thrombosis and has been instrumental in raising awareness about the condition through her work with Thrombosis Canada. Welcome to What She Said, Dr. Siegal.
Thank you. It's a pleasure to be here.
So for those who are listening who are unfamiliar, can you quickly explain what thrombosis is and how you might develop it?
Absolutely. So thrombosis simply means blood clot, and thrombosis is actually part of the normal system in your body to stop bleeding for things like trauma or surgery. But sometimes things can go wrong, and then a blood clot can form in a blood vessel in your body, either an artery or a vein, and that can cause problems such as ischemic stroke, where the blood vessel is in the brain, or a pulmonary embolism, which is a blood clot in the lungs, or a deep vein thrombosis, which is a blood clot in the veins of the legs.
And you've done a lot of research into this, obviously, and your recent research study surveyed Canadians about their knowledge and attitudes towards blood thinners, anticoagulants. So what prompted this study, and what were some of the key findings?
Thank you for the opportunity to discuss this. It's, patients who are taking anticoagulant medicines, those are commonly referred to as blood thinners, although they don't really thin the blood. We sort of say that colloquially. But one of the important complications of anticoagulant medicines is that they can increase the chances of having bleeding. Now, they don't in themselves cause bleeding to happen, but they can make bleeding worse. And that's because they sort of slow down the blood clotting system in the body. And so we wondered whether or not people were familiar with this as a complication of anticoagulants that can sometimes lead to life-threatening situations. And we wanted to make sure that people were aware of what to look out for and when to seek medical attention. So we conducted a survey of people who are taking anticoagulants for various reasons out there across Canada.
And what were some of the findings then that you came across?
Absolutely. So we found that the most of the patients or participants in the survey were taking anticoagulant medicines for things like atrial fibrillation, which is an abnormal heart rhythm that predisposes to having blood clots go to the brain or stroke, or a deep vein thrombosis or pulmonary embolism, which are blood clots in the legs or the lungs. And we found that some patients, almost half of patients actually admitted to missing or skipping doses, which is really important. And we also found that people were concerned about bleeding, but that perhaps bleeding wasn't something that was discussed as regularly as they would like. They wanted to understand more about bleeding complications, how to prevent them, and also how they can be treated if they're serious, like if somebody ends up needing to be in the hospital.
And what are the risks then if somebody skips a dose?
Well, people take anticoagulant medicines to protect them or prevent another blood clot or treat the blood clot that they currently have. So, it's very common for people to sometimes miss doses for various reasons. Obviously, we want people to be as protected as possible. So we encourage people to take their medications as prescribed, every day, understanding that sometimes things can take place in their life that interfere with that. So I think it would be very important for people to take their blood thinner at the same time every day as they're prescribed. If they miss a dose, and recognize that really soon afterwards, like within minutes or even an hour or two, that's fine. They can, probably take their medication. But, we don't advise people catching up doses, for example. We would want to ensure that people are most protected, and that means taking the medication as they're supposed to. I think if people are having problems taking anticoagulants, missing a lot of doses, that's really something that's important to tell their physician. We really want to know if there's a way that we can help people take their medication more reliably so that they can be optimally protected against blood clots.
And there seems to be a misconception around anticoagulants causing bleeding. So can you clarify this for people listening and explain the difference between major and non-major bleeding while on these medications?
Absolutely. So when we talk to people and we start anticoagulants in the clinic, we often will describe that bleeding as a complication of anticoagulants. Now, fortunately, the vast majority of people don't experience serious bleeding problems, but some do. So about 2 to 4 out of 100 patients every year will have what we call a major bleeding problem. So that's something that where they're having a bleed, for example, the most common is from the stomach or bowels. And the uncommon is bleeding that occurs in the brain, which can actually be really serious. So these are bleeding complications that would, make a person likely to seek medical attention in the emergency department or perhaps need hospitalization. That's another 10 to 12% of people will experience less serious bleeding, but they still may want to go see their family doctor or nurse practitioner, for example, or even go to the emergency department for bleeding problems. And this could be like nosebleeds that won't stop, sometimes other types of bleeding, blood in the urine that can be alarming to people. And then there's kind of less serious bleeding. So it would be like a minor nosebleed, for example, that stops on its own after a couple of minutes, or maybe, minor hemorrhoidal bleeding that may not cause problems, but actually these events are still helpful for patients to communicate to their family physician or nurse practitioner so that they can be monitored over time and make sure that they're taking the dose correctly, that there's nothing changed about their blood tests, that there aren't any other concerns going on.
And your study also then highlighted a lack of awareness about treatments that can reverse the effects of blood thinners during one of these major bleeding incidents. So can you tell me more about how they work, these reversal agents?
Absolutely. So when people have major bleeding problems, so that would be a bleeding that might bring a person to the emergency room or admitted to hospital that were more serious or life-threatening even. Sometimes we have the opportunity to what we call reverse the anticoagulant effect. So that means that remove the effect of the anticoagulant from the bloodstream quickly in order to help the people stop bleeding and to ensure that they have a good outcome. So it depends on the type of medication or anticoagulant that a person is receiving. There are different reversal agents. For example, for warfarin, we do have separate reversal agents. That's of course, a type of anticoagulant medicine that people are familiar with, needs blood testing, to monitor the levels. We also have other anticoagulant medicines called the direct oral anticoagulants, and there are treatments available, for example, that can, rapidly reverse the anticoagulant effect in the bloodstream in the event of, a serious or life-threatening bleeding problem. Sometimes we also give medications that don't reverse the anticoagulant effect, so they don't act as like an antidote, but they may help your body stop bleeding by giving additional coagulation factors in the blood to help a person stop bleeding.
Well, October is Thrombosis Month and World Thrombosis Day, and I'm sure people listening right now are just, their heads are swimming with information because this is a lot. I had no idea about any of this. So what initiatives or events can people expect from Thrombosis Canada to raise more awareness about this condition in the month of October?
Thanks so much. We are also very keen to raise awareness and spread the word about thrombosis. And through Thrombosis Canada, there are webinars taking place that are free for people to sign up for. We also have tons of resources on our website, so please go check that out, thrombosiscanada.ca. And then finally, we're actually going to be lighting up the signs in cities across Canada in the World Thrombosis Day colors, red, white, and blue, to raise awareness. But please, if people have questions, check out our website, thrombosiscanada.ca. Talk to your primary care physician or nurse practitioner, and make sure that you're aware of these complications.
Well, actually, that kind of leads me to my last question for you. If somebody's listening and they are on blood thinners or know somebody who is, what advice would you give them to ensure they're managing this condition safely and effectively?
Really important that people have regular follow-up with their prescriber. So either, a nurse practitioner, for example, or a primary care physician, just to make sure that, things are in regular follow-up, make sure that things are going okay. It's always really important to update your physician or nurse practitioner about new medical problems that come up over time. They may not always be aware. It's also really important to let them know about any new medications that other doctors will have prescribed. And I always tell people to, find a pharmacist who can manage all of the medications. It's helpful to go to one pharmacy so that pharmacist knows everything a person is taking. And that includes things like naturopathic products or herbal medications that sometimes can interfere with how anticoagulants work and can increase the chances of having bleeding problems.
All right, excellent. And so one more time then, what's the website again people can go to find more information?
Thrombosiscanada.ca.
All right, incredible. Thank you so much for joining me today, Dr. Siegal.
Thank you so much for having me. It's great.